Now you do want to prevent unwanted movement in spaced cases. Now how you do this is you do not perform that significant space closure on light wires, on nickel titanium arch wires. Why don't we retract or close significant spaces on these light wires? We're trying to prevent what's called the bowing effect. Now there's two types of bowing. There's vertical and transverse. Vertical is far more common, and it's more common on the upper arch because the bone isn't as dense as it is on the lower arch. What I want you to imagine we took a shape memory nickel titanium arch wire in our hands. And we go ahead and we compress the palms of our hands together, which mimics the force we get from a full molar-to-molar power chain. What's going to happen to that shape memory flexible wire as I push my hands together? It's going to arc or bow. Now remember, the teeth follow the wire, so what's going to happen to the anterior teeth? They're going to tip lingually. The posterior teeth are going to tip mesially, and you will get an open bite in usually the premolar and canine area. If any of you have been doing any cases and you're trying to get that final space closure with your full power chain, and you notice you got an open bite in your canine and premolar area, chances are you got bowing. Okay? So here we are with the teeth. We have a beautiful level arch form. We place a power chain on too light of a wire, and we have bowing. Okay, the anterior teeth will tip lingually, the posterior teeth will tip mesially, and you get an open bite in the bicuspid and cuspid area. Here's a clinical case where we got just that. This patient is wearing upper lingual braces. They have an 016 nickel titanium arch wire on with a power chain from molar to molar. And you can see how the anterior teeth are tipped lingually, the posterior teeth are tipped mesially, and you can really see the open bite in the canine and first bicuspid area. Now, bowing is an absolute time killer, okay? You do not want to bow the arch because it's just going to kill time. You know, you looked good, you know, at 1 month. The next month you have bowing, and now it's going to take maybe 2, sometimes even 3 months to correct it, depending how bad it got, okay? You kill 3-4 months on a 6-month case, you are going long, and hopefully the patient doesn't have, you know, a wedding. It's not the bride-to-be. Or a 50th wedding anniversary party for, you know, the groom or the bride as well, okay? And whenever you have bowing, you have to immediately correct it. It will only get worse, okay? More on that in a second. So here we are. We looked like this last month, okay, with a beautiful level arch form, and now we've bowed the arch, and you have to correct that. It can get bad. Okay, it will never get better on its own. You have to correct it the second you spot it. Now, how do you prevent it? The best thing to do is just prevent it. Use larger, stiffer arch wires when you're closing spaces, preferably steel arch wires. Steel is stiff, unlike nickel titanium, which is flexible. When you push steel in between your hands, it is not going to arc or bow. It will resist arcing or bowing. Additionally, steel has lower friction than nickel titanium, so your spaces will close faster. So use steel. Another trick is you can place what's called an accentuated curve in the upper arch wire. Accentuated curve is basically a curve placed in the arch wire that goes the exact opposite of what bowing does. Okay? So you take a hollow chop plier, and you're going to put a nice gentle curve in the arch wire. So you have a nice gentle curve, and that wire is bent in the exact opposite direction of bowing. If you turned a bowed wire upside down, it would look like this, and that's going to help prevent bowing. Now, I typically only do this if I had a situation where I actually had bowing that I had to correct, which doesn't happen that often at all anymore since I started using steel wires. We automatically do this in lingual cases, though, because lingual cases are more likely to bow. More on that later. Here's how you place the accentuated curve. On the lower, it's called a reverse curve with the hollow chop plier. Just start right around the first bicuspid area and use that hollow chop plier just with a nice light feathering motion. You see how that curves up ever so nicely? Now you're going to do the same thing on the other side. A nice light feathering motion from about the first bicuspid back. and then look at it in side view and make sure they're even. If they're not even, adjust as needed. So once you have bowing, you have to correct it. It will not get better on its own. It will only get worse. The first thing you do is take off the power chain. That's the engine that drove the bowing. You have to let the arch re-level. So just, use your shape memory nickel titanium to re-level the arch. You can also add in some triangular elastics from the upper canine down to the lower canine in first bicuspid. 1/4 inch, 3-ounce elastics work great. You have to re-level the arch, and then you can go ahead with space closure. Again, it's a time killer. You've just lost, 3-4 months on the case, and you're back where you started from. Because you went ahead, you put your power chain on, you got bowing, now you corrected it 4 months later, now I'm back where I started with those spaces again, okay? So make sure to prevent it. Use that steel arch wire. It's really going to help you. And follow your power chain rules.
To make sure you don't miss any of our Powerprox pointers, please subscribe at 6monthbraces.com/orthotips. To learn more about our live seminars for Powerprox 6-month braces, please visit 6monthbraces.com/live-seminars. To learn more about our unlimited case support and online seminars, please visit 6monthbraces.com/online seminars. If you prefer to call us, our phone number is 440-646-1000. To learn more about our laboratory services for Powerprox 6-month braces, which include digital bracket placement, 3D printed indirect bracket bonding trays, digital case setups and treatment simulation images so you and your patients can both see the case results before you even start, IPR guides so you know the exact amount and location of any IPR that you may need, and a lot more, please visit 6monthbraces.com/PowerproxLab.